Good afternoon, everyone. You are very welcome to the HSE Health and Wellbeing Engaging Men webinar series, The How of Men's Health. Before we begin, a little bit of housekeeping. The webinar is being recorded. We are in Zoom webinar format. Therefore, during the live event, you can use the Q&A feature to ask questions. This is located at the bottom of the Zoom window on your PC or laptop. If you're using an iPad, you will find these features located at the top of your screen. Without further ado, I would like to hand you over to your host, Lorcan Brennan.
Thank you very much, Helena, for minding us and bringing me in and reminding me I was on mute. A lovely introduction to the start of our webinar. My name is Lorcan Brennan. I'm from the Men's Development Network, and I'm so delighted to invite all of you here again for the second in our series of Engaging Men. This is International Men's Health Week. It's a really big week on the island of Ireland for men, and it's a big week for all those people who are engaged in supporting men as well. And I'm here with the team today, who are with us the last day as well. And the team are from the HSE and from IT Carlow and from the Men's Health Forum in Ireland, and of course from the Men's Development Network as well. And we're delighted to be here for International Men's Health Week. And this year we're talking about making the connections and checking in and checking up and checking out, which are part of Men's Health Week. And we'll say more about that later on. We'll have Fergal Fox on from the HSE, and he'll be saying about Men's Health Week, and he will be calling us to action as well as we go on. But before we do anything else at the start of our webinar today, can I ask you please to sit back, because we're bringing you a short video by Minister Frank Feehan. And the Minister is wishing us all a really good Men's Health Week, and he's inviting us as well just to, I suppose, take part in the week as best we can. So I'm going to hand over to Helena, and she's going to show us that video, which is a warm welcome to each and every one of us. Well done.
Good afternoon, everyone. I am very pleased to have been invited to address you today on the occasion of the How of Men's Health webinar. It is very fitting that this event is taking place during Men's Health Week, when we come together to raise awareness of men's health and what we can do to improve it. The need for a continued focus on men's health is grounded in the evidence that men die younger than women and have higher death rates for the leading causes of death, including accidents and suicide. Research suggests that compared to women, men have more limited contact with GPs, can be reluctant users of primary care services, and more often present late in the course of illness. These are trends we need to reverse to improve the health and well-being of Irish men. And as you will all be aware, Ireland was the first country in the world to publish a national men's health policy in 2009 and has been to the forefront internationally in advancing men's health at a research, policy and advocacy level. Well done to everyone who has been involved in this. It is very much needed. The HSE National Men's Health Action Plan, Healthy Ireland Men 2017-2021, sets out a new vision and roadmap for men's health. Good progress has been made in implementing this plan, in particular with the increased delivery of the Engage Men's Health training programme to improve the way health and social care services are targeted at and are delivered to men. We have all seen the promotion of health and well-being in men's sheds across the country through the network of over 400 men's sheds in Ireland and through the development of an evaluation programme for Sheds for Life. Earlier this week, my colleague, Minister Donnelly, launched an impact report on the Sheds for Life programme, which showed very encouraging results for the programme in a number of areas, particularly an increase in levels of physical activity and benefits for mental health and well-being. Programmes such as Men on the Move and On Firm Ground are making a real difference and supporting men in making their journey to better health and well-being. And I understand that the theme of this year's Men's Health Week is making the connections. And I want to take this opportunity to endorse the call to action behind this theme. And this encourages men to check in with yourself to see how you're coping with check-up on your family, friends, neighbours, colleagues, to see how they're doing and to offer support. And to check it out and seek information or help on any health-related worries you may have. It only remains now for me to thank everyone involved in putting together this webinar, particularly the Men's Health Forum and the Men's Development Network and Carlow IT. I've no doubt that it will be an interesting and helpful event and help make a great contribution to this year's Men's Health Week. Thank you.
Thank you very much, Minister, and what a warm message for all of us for Men's Health Week. And it's really great that we're all here, and really appreciate that message from him in supporting us for being here today as well. So folks, look, this is the second in the series of our webinars that are going to run until the end of 2021. We're delighted to be here for Men's Health Week. And especially we're here today, as I say, focusing on the how of engaging men in relation to our health, which is really important. The first webinar, we focused on the why, and now we're here for the how. Across the afternoon, we have our questions and answer, our Q&A bar. If there's anything you want to put in it, please do that for us. And we will come back and we will have a look at them again later on. You might have some of your own professional or personal thoughts on how engaging men is important in your own work or your own life. Minister's already said it there as well for us, that I suppose that there's a lot already has been done in the island of Ireland, and especially in relation to policy, and especially in relation to other things as well. And so what we're here today to do is to look at the how of engaging men. And how we're going to do it is we're going to show some videos, and we're going to talk with some really interesting people. And then we're going to have a panel discussion where we're going to bring our people together and to talk in more detail as well about engaging men. Now we have as well with us today, you probably saw it on the poster, we have the legend David Brady, who's going to join us, and he's going to talk to us about his lovely piece of work that he did himself through COVID in relation to engaging with men and his contribution as well. And he'll talk about his pledge to action for Men's Health Week. And then we have a panel that will join us later on. We'll say a little bit more about our panel when we come to it. And they will join us for a discussion later on in the event as well. So the very first place we want to start, I suppose, is sometimes it's seen that perhaps as men we can be difficult enough to engage with. But I suppose before we arrive at that conclusion, it's really, really important that we look perhaps at some of the barriers or the obstacles or whatever else might stop a man from engaging with health services or with his own health. And so we're asking you to sit back again and just watch a short video, which is called Through the Eyes of Men, that looks at some of those barriers. And we'll come back and we'll talk to you immediately after that. So thank you, Helena, if you can show that video, Through the Eyes of Men.
Yeah, it feels like the flu, or maybe just a bit of a bug or something. I'll be all right. I think I'll be all right. It's just I was up a little bit of the night. Yeah. I know. I'll keep the emails open. I'll keep an eye on it. You know, I just don't feel great now today, but I will be in tomorrow. Yeah, bright and early. I'll be in.
Thank God that phone call's done. I feel better for that already.
I wonder who are the crowd organising it. What's their agenda? I wonder what's in it for them. What's in it for me though? I wonder what's it going to cost me now in money. I'll be missing other stuff as well. I'll be away from the family. I think I'm away enough as it is. I wonder what kind of commitment is required. I'll have to share personal stories about my life, failures and things. Be asked personal questions or maybe other details.
I must empty those bins.
I wonder who it's really for. Why has it been offered to a fella like me? I wonder where does the information go after you give it to the organisers? And then this could maybe affect my medical card or my supplement, or if I got involved, I want to find that out. What if there's someone there that I know might judge me or talk about me to some others? Or what if there's nobody there I know? I don't know anybody. I feel like a complete outsider. How would I explain it to others why I'm going? But what I'm doing at it, for example? What if I don't know what to say or what to do? I wonder is a kind of a man's thing to be involved in, or all these kind of things. I think they're for someone else. I'm not sure they're for a fella like me.
As usual, you're overthinking it. Just go and do it. I hadn't said it to you, but post arrived on Monday. I was off work. It arrived through, it was a flyer.
Oh yeah, I know the one you mean.
Yeah, it was for this men's health thing, you know, that they invite.
What do you think?
I don't know whether I'm the type of guy to go to these things. It's in a hall, it's in a place, other guys coming along. I just don't know whether that's for me.
That sounds good. That sounds like what you were looking for.
I thought it was, and then when it arrived, I'm apprehensive about it. I just do not like going, yeah.
That's normal. A bunch of men in a room together, all chatting, all feeling the same as you. You know, everyone will feel like that.
It looked interesting. It looked like it's going to
On
be,
your own.
I think it was actually called A Picture of Health. It looked really interesting. It looked very positive.
Perfect.
But I just still have a about going and turning up.
Oh, that's normal. It's normal. Don't worry. You'll be fine.
I'll show it to you. I'll get you to read it first before I do anything.
I'd like to see it.
There you have it, folks. Some of the issues and the barriers that can stand between a man and a service that we know from evidence. Literally every line that went into the making of the little video had come from some man somewhere, either as part of a focus group or part of the training that we've been doing through the National Men's Health Training Programme that's been rolled out across the country and that the Minister had mentioned as well. Now, in a way, we're going to bring some of those barriers and obstacles and procrastinations into our panel discussion in a while. Before we do that, I suppose if there are some of the barriers, one of the things now we want to look at are what are the ways we can engage that we know about. And in our training and development program that is here behind me, one of the key pieces of that is a unit called Unit 4, and it's called the Rules of Engagement. And one of the people who's here with us today is Anne Farrell, and Anne is Health Promotion Executive with CIE Transport Group, which is also one of our engaged trainers, and she's also one of our mentors. And she's going to come on now, and she's going to speak to us about the rules of engagement and tell us something of her experience also. And you're very welcome. So
thanks everybody. Thanks, Lorcan. So I'll just kick off with my first slide. You see a picture there of a lot of men jumping with joy and glee and full of engagement. This is actually a picture from a program I did a good few years ago in Dublin Bus called Gutbusters. And as you see, there was a lot of crack and fun in that program. So just moving on to the next slide. So today I'm just going to talk from my perspective and insights in learning as an engaged trainer, and just a little bit around you know, how to engage, what the barriers are for men, the rules of engagement, what works in the future. So next slide there. So this is an article that was done in the Rail Brief in Irish Rail, a staff magazine, when we started doing the Engage training. And to date, I've completed 3 Engage facilitator programs, the Men's Health Engage, the Engage Young Men and Engaging Middle-Aged Men. And these programs have given me such a really good insight. They are backed up by strong evidence on how to engage successfully with men in the workplace. And personally, they've also given me a ready-made network of expertise in men's health. And all the courses were so well thought out and a joy to be on. And I always left with a pep in my step and a rejuvenated energy to work with men. So the Engage training has taught me lots. It taught me to focus on the positive aspects of men's lives and to avoid that narrative that men aren't interested in their health, and to, you know, to kind of portray men, you know, in a positive light. And also just the language I use when I'm working with men to kind of focus on them, hearing men's voices and listening to men and kind of providing encouragement and support. So I kind of weave all that into the workshops with men. And to date, I've delivered about 20 programs with Vinny and Murray, my co-facilitator. So we've worked in a lot of different companies within the CIE group, like Dublin Bus, Bus Éireann and Irish Rail. And we have a workforce of up to 10,000 staff, with 90% which are men. So these are just some engagement facts around corporate well-being. And the reality is that women do engage a lot more than men in workplace programs. And I suppose it's interesting, this is reflected outside. Recently I tuned into Aware, had some webinars, one for women's health and menopause and mental health and men's health. But they realized that there was 3 times more engagement in the female webinar than the men. So that's kind of very much reflected in the workplace as well. It can be a challenge to get men involved. So men are more likely to get flu shots at work and to participate in smoking cessation programs. And 40% of men responded that their families prompt them to participate. So targeting female spouses may be an effective way to encourage greater engagement among male employees. And this was a report in 2014. So, you know, I would try and bridge with all the programs I've done in the past. With the Gutbuster program, I would have built a bridge linking in the spouses and their families and communities, and also the Life Fit program I did. So Operation Transformation does this very effectively. You can see how they bring their families in. So, you know, the ladies play a big role as well in getting the men engaged. Well, just the next slide there, Alina. So what are the barriers that are holding men back? This is just an interesting slide. It was research done in a GP surgery in 2016, and they looked at the previous 3 months attendance between men and women. And you can see there's 5 categories there, and the first 4 categories, you can see that women's attendance is a hell of a lot higher than men. And it only kind of comes even around retirement. And this is sadly, you know, for men, they probably leave it so long to integrate, and, you know, chronic illnesses and lifestyles issues have set in by then. So the barriers would be, you know, I've noticed myself, you know, with men, shift work demands, no time, and that masculinity stereotype, you know, that men are strong and stoic and men don't get sad, or, you know, men aren't vulnerable, and this can hold them back. And also maybe some programs that men's needs are not addressed in workplace wellbeing programs. Another common thing is lack of trust in the service, lack of fear, embarrassment, and another thing I would really, since COVID has come in, because a lot of our services have moved online, is maybe technical barriers, not having the skills, especially in our older demographics, it can be a problem. So I'll just move on to the next slide. So as part of the Engage program, the rules of engagement was a really good module that, you know, that I found very helpful for my own work practices, and this is all evidence-based. So, you know, showing, developing a positive approach when working with men, and, you know, seeing men as a, you know, a positive, you know, seeing their strengths and really highlighting that to men and getting them involved in the process is important. Finding a hook. In the past, I've done a lot of health screening right around the country in their porter cabins and, you know, their canteens, and health screening is a great way of getting men in the workplace, and they'll come for that 30-minute screening and coaching session, and they might during that time maybe share an issue that they hadn't shared before. Also using competitions or inviting them into for a challenge. With the Gutbusters, we would have used weight loss as a challenge, and one of the garages lost 13 stone, which was like losing a man. Another thing I used to do was like race to a healthy waist, you know, in inch losses. So in one of the Gutbuster programs, the accumulation of inch loss was the circumference of a double-decker bus, and that really did appeal to them. So yeah, using competitions. Recently in Irish Rail, we launched a program. We had lots of Fitbits and hampers as competition prizes. So having encouraging a hands-on approach, like men like to fix things, they like to get involved, and, you know, really integrating them into your program is really important from the start. It was interesting, just recently I've been involved in a LifeFit 12-week online program with night workers. And on the onset, I asked them, how would they know that this would be a success? How can we measure it? So they came up with the concept of a challenge called the 1000K Walk, Run, Jog Challenge. And there was a charity aspect to it. They were raising money for a sick colleague. And to date, we haven't even reached the 12 weeks. They've exceeded the 1000K overall, and they're interacting a lot on their own WhatsApp group. So this is a real success. And it's good to really ask men, you know, what appeals to them. And, you know, they come up with great ideas. And so it's much better than me being prescriptive, that you integrate, ask them. So male friendly, my workshops with Vinny and around the country, we would set it up in a way that was very relaxed. When men came into the room, we would have music going on in the background, and, you know, greeting everybody as they came in, and having packs that, you know, that had publications like the Man Manual and, you know, male friendly literature, you know, that was enticing. Making the service accessible as well. So, you know, definitely going to where men are at. So in the past, you know, I would have gone out to porta cabins, you know, late at night to meet night workers, and they really did appreciate it. And I got like 100% engagement when I went to where they were at. And especially, I think, you know, workplaces, men are very relaxed and they're comfortable at, you know, much more so than clinical settings. I know recently, a few years ago, the Irish Heart Foundation did a program with the farmers in the marts, and they had like super engagement there. So that's a key thing. Communicate appropriately and be respectful to men, and use language that lands with them. I use a thing called clean language, and that involves really actively listening to men when I'm coaching them and in group sessions, and, you know, repeating the language back to them that, you know, resonates with them is important. Focus on marketing and initial contact as well. Really, you know, if you're publicizing any programs, get the men to actually advertise it. Like last year from November, we got about 30 men to share positive affirmations with each other on our, you know, workplace platforms such as WorkVivo. And that really goes down well, because it's them, they're promoting a positive message to each other. And also it's important to have an experienced service provider or facilitator. And the Engage program gave me really good grounding skills in facilitation. And I've since went on to do a master's in advanced facilitation, because I really feel it's such an important piece that, you know, a good facilitator can set the environment and, you know, really encourage active engagement. So involve men in the program and, you know, collaborate with them from the start. And with the Gutbuster program, I would have got them involved in designing the logo, and that, which was a fat bus, and you know, they really owned it, and, you know, they enjoyed it for that. Strive for best practice. Definitely become part of the Men's Development Network. Collie Fowler sends out a really good email magazine, all on the latest research around men's health. And Ireland, as it's been mentioned, was the first country to have a men's health policy. So there's a hub of activity around research and evidence for engagement. So plan small and realistically, you know, keep it you know, tangible and clear, and have your outcomes, you know, very clear, and, you know, that the men understand that. And challenge male stereotyping as well, because men, I think we just need to repackage how we sell well-being to men. It isn't that they're not interested. It's, you know, we have to become more, you know, from their perspective, it make a difference. So I'll just go on to the next slide there, Lena. So this is some of the appealing language that works well. Taking control of your heart, nutrition for a strong heart, all of that. And here's more, the Man Manual. And you know, this is literature I would have used in the past, and, you know, put into men's health packs. And I'll just go on to the next slide. So last year I did a postgrad course in workplace wellness in Trinity, and we had a project just looking at how to engage men more effectively. And these were some of the nuggets, you know, that we had that we found. So definitely now with COVID, set up maybe quarterly focus groups and encourage small breakout rooms with men and ask them and just hear what they want. That really works well. Developing champions, health champions, and getting engage, train your staff in the Engage workshops and join the Men's Development Network. There's like about 30 facilitators around the country, and they will come into your workplace and deliver. Try and destigmatize mental health at work. There is still a lot of stigma around mental health, and I've met employees that would suffer with mental health and use their holidays, instead of taking sick leave. So there's still, we have still a way to go. We've brought in Aware and SOS, and they've done really good workshops. Have, the inviting comms language, and if preferable, do it on company time, like the way safety stuff is done, and try and dedicate maybe 1 to 2 hours a month for well-being, and develop, this whole psychological safe culture and health culture within the workplace. So I'll just move on there, the last slide. So the roadmap to the future, really, it's important to try and promote Men's Health Week. It's getting better every year. There's really good tools that have been developed. Join the Men's Development Network, train your staff in the Engage Men's Health Programme, and do a needs assessment for your staff considering gender needs, and consider the needs of men in your wellbeing strategy, and get managers and leaders to lead by example by integrating wellbeing into their teams and engaging personally in the wellbeing programs offered. Recently, we had our CEO, Jim Mead in Irish Rail, that launched our program, and he talked about his own wellbeing journey, and that really went down well. Promote Movember. This is a positive thing, and try and ensure resources and opportunities are available and accessible to all employees to create an environment which everyone, including men, can see an upside in taking part. So that's a bit of a whistle-stop tour. So thanks for your attention.
And that was absolutely superb. And you bring all that you've talked about, your capacity building, bringing it into the workplace, and also the evidence that you've seen. That jigsaw is just so fantastic there, around the 12 things we know, the 12 lenses in relation to evidence. And you're going to stay with us. I know you'll be back to the panel in a while, so we really appreciate that. And people watching, I know, will have seen and learned something really clearly about what we know about engaging men from that lovely presentation, and really, really clear. So thank you very much, and we'll see you in a while on our panel as well. So go well. So thank you, Anne. And as I say, she's going to stay with us with some other lovely panel members we have that will join us in a while. But I'm moving along fairly lively as the time is moving on us to talk about a wonderful guy, David Brady. David Brady is a footballer from out west, from Mayo. He's given us some really fantastic moments on screen, on the pitch, an absolute athlete who really could turn in the style with that football going up along the pitch. And he doesn't just sparkle on the pitch, he sparkles also in personality. I've just got to know him by phone, as some other people have as well in the last while, because he was so generous to say he would come here today. And there's a short video we're going to show you about what David did as part of his response for COVID. And it's actually linked, I think, right into the heart of what we're about for International Men's Health Week, around making those connections. So Helene, if you show us that short video, please, it would be really good. Enjoy this, folks, and we'll be back with David in a few moments.
There's a chance here for David Brady to make some headway, to put it over.
The GEA is the fuel for conversation, the fuel for communities and for cultures. It's about what the game represents to you. When COVID came, I suppose we all as a person say, look, how can I help? I got a direct message. I was asked by the son of a man living in Wicklow, originally from Mayo, would there be any chance you could give his father a ring?
He would have always been someone we'd admired as a footballer. I said, would you ring me, Dad, just for the crack, like, and see how it goes? I'm sure he'd love it.
I read that and I went, I'll give him a ring. And I rang Tom. He said, anyway, who are you? I said, I'm David Brady here. I played for Mayo for 14 years. And I said, just wondering, Tom, how are you keeping? How are things in here? You up to talk about a GEA? And he went, is this a skit?
I got a phone call and I recognised the voice. Some people just actually make a connection with you. I'd felt I'd known them all my life. I was on a high for the evening after it now.
From that moment, for me, I knew what I was going to do. How you doing? Is this Chris? Jeff, you don't know me, but I know all about you. I hear you're GAA mad.
The way he picked up a simple message and then said, I can make this into something huge. And he has, so hats off him. But it couldn't have been done without David Brady and the power of his personality.
It was hard the past few months. We got to see Dad during the day over in the field, but Dad would come home then in the evenings. He'd be on his own and we couldn't spend any time with him, so it was lonely for him.
When you haven't got something, it's very important to talk about it. And that's what's happened with COVID and GAA. We haven't had the games, we haven't had the controversies, but we've talked about it. I don't know whether to shake your hand or I'll give you a hug.
Yes, a fair play to you, boy, yeah?
Francis, we finally meet.
Well, you're welcome.
A pleasure to be here, Tom. Good to see you.
Holy mother of God.
I honestly feel, as a community and as people, we are stronger now than ever before. And I won't say it's thanks to COVID, but it's thanks to the way that GAA people reacted to it and kept that flame alight.
David, that is a fabulous video and just sings of heartwarming connection. International Men's Health Week is about making the connections, and certainly you made the connections in picking up the phone and responding to that young man's invitation. And you know, through sport, can I start with that? What do you think is, you know, what's the link with sport? And for many people, not for all people, but for many people, it's a really remarkable conduit for getting in to talk about other things as well.
Hi, Lorcan, and look, it's a pleasure to be here today and just talk about making connections. But the big thing about sport is everyone's opinion counts. Whether it was last Monday and people talking about Offaly getting to, you know, Crow Park this weekend, or look at, I've been off in the part of the conversation where it wasn't really useless yesterday, and people say, you know what, he was, and it just sparks everyone's opinion from sport, whether it's rugby, hurling, GAA, any sport, their opinion counts. And that creates one thing, conversation. And it leads to something else. And people get vexed, or people show passion about it, or people show interest. And everyone's opinion on sport is valuable, and it's listened to. And from that, for me, and just seeing Tom there again, like when I was even filming that, like it happened as he didn't know who was coming around the corner. They asked him, do you mind if we shoot a few bits about the phone calls that you had with David and blah, blah, blah. Next thing the film crew was saying, come up now, come up, come up. I walked like around the corner, and it was like we didn't shake hands, but I didn't know whether to give him a hug or shake his hand, because I felt I had made a connection with him. And we had talked, and again, he's a farmer. My father's a farmer, and yeah. I could link, and as Anne said there in her piece, it's awful important to listen, and at times, and I was proud to do it, and I had some of the most valuable conversations with people I'll ever have in my life during the last 12, 16 months, and hundreds of phone calls. But I learned one thing, and I had to say to myself at times, Jesus, David, will you listen? And that was it. I listened. I'm a great man for talking and talk too much at times, but I listened, and that was for me a valuable lesson.
Fantastic. And David, I was the young man that made the phone call to you. I was just looking at him again, and around his dad, you know, and you made the response, and you actually did listen, and you made the phone calls. With that young man as well, through the COVID, he stepped in and he actually made a phone call to see would you come on board for it, which was a brave thing as well around making that connection. You know, and I'm just conscious, especially through COVID, we often hear about the younger people, you know, but young men and women in Ireland, especially through the sports and community-based groups, they really stood in the gate across COVID and got to know their neighbours through responding and making those connections. that's really been fantastic for our younger people, the call to action in relation to younger people and younger men getting involved.
And that's it. And I see someone put in the chat there during Ann's presentation about the puzzle. And we're all a different part of the puzzle. And Kevin, who was the son of Tom, said, you know what, maybe the jigsaw of David Brady having a chat with Dad, who was cocooning and isolating and finding it hard. And there's no one that hasn't found it hard. But he put that piece of the jigsaw together and he goes, sure, what have I to lose? I'm only asking a normal human being. Would he make a call to another human being? And Tom was herding heifers at the time, right? But I knew I was interrupting, but he stalled. But as it transpired, as I got to know Tom, he was herding heifers for an 82-year-old neighbour. So he was doing something for someone else that needed help. And if you put them 4 parts of that jigsaw together, you're going, very simple. It was someone doing something for somebody else because of something. And that's, and I look at, to say, and I'll never forget some of the conversations. And I've nearly documented every single one of them in some way, shape or form. Men that were so isolated. Probably one of the most, I suppose, special ones was a call with a guy called Chris, who was a teacher for 43 years. And I rang him and our call lasted 1 hour and 49 minutes. And after about 1 hour and 47 minutes, he said, Jesus, David, we haven't talked football at all. And we didn't. And in the video you showed there at the start, it was, I think there was water and flowers. And he was a teacher. And he felt isolated after he retired. He wasn't married. His nieces were the fulcrum of his life. But he said he hit a dark cloud. And I said, how did you get over it? And he says, you know what, he says, I started doing a bit of gardening. And I started treating the plants like my pupils. And I started nurturing the plants. And he says, you might think I'm mad, but I started talking to him. And I'm going, I don't think you're mad. I said, I think that's a lovely way of saying you found something to focus on. And again, from the men's sheds point of view, or that the gut busters, as Anne talked about, there's always something. And it was absolutely lovely. And he was nearly embarrassed that we didn't talk football. And I'm going, I didn't ring to talk football necessarily. I just rang to talk. And we talked.
David, you've identified right at the beginning of the program today, when we came in, we started with the fears and the procrastinations and the obstacles that stand in our way as men to getting that support. That man had that phone call with you, so significant. And Anne talked about that as well, around breaking that down. As part of team sport for you, you know, has that been an important place for you as a man to be able to come out as part of a team where you win and you lose and you have good days and you have bad days, that you can learn something around reaching out and connecting as part of a team that you wouldn't maybe be able to learn by yourself in a more isolation sport?
Look it's probably the greatest educational tool for me from a sporting context that I've ever had. I wasn't the best footballer, far from it. I was a good teammate, a good team player. But from a sporting context, and like what you have now is we at times talked about our own insecurities. We had an open forum, not about, but our own insecurities in life. And that kind of opened you up to realizing that, you know what, you might think that whoever's in the All-Ireland final come August this year, the 30 guys that sit in the dressing room are the greatest people in the world, and they are. But we all have little frailties. And look at one big lesson for me from sport was, you know, I learned how to lose. Like I played All-Ireland finals in 94, 21, 95, last 96, last 97, lost a club final in 98, last 2004, last 2006. And what really I learned is, and when you're in an All-Ireland final, you're the man, you're at the peak of your prowess. You're on top of the world, and then 3 weeks leading into an All-Ireland, people want a piece of you. Everyone wants you. And whether it's locals or community or friends or, you know, the press, the people that came to me on the Monday, Tuesday, Wednesday, Thursday after losing in Ireland, like for me, they were the ones that went, I didn't bother them the last 3 weeks, but I'll bother them now. I'll ask them, how are you? Where are you? Do you want a cup of tea? Are you around for a coffee? How's things? How's the head? Look, we're still here for you. And it's a very Irish thing, but it's then you realize the power of, well-being. And well-being is, well, how are you keeping? How are you doing? And everything else. And I just think there's a massive momentum behind what we have in Ireland now, that we realize as people, man, woman, and children, that well-being is nearly the most important thing. And again, we look at, it's been a very hard time, and a lot of people on this call are frontline workers, our HSE workers are dealing with people that are very, very vulnerable and putting in a massive effort for it. But we have the opportunity to keep that going and to learn from it. And I really want to continue it. Not just, but in normal day life, and listening to people who are making that connection or making that going, you know what, maybe I need to ask them, or maybe even personally, maybe I need to say something to myself, that should I or could I? And that's I think a very positive thing that's come from me from the last 15 months, and I'm never ever going to let it go again.
David, we're running on time. I could stay here. I have so many questions I wanted to ask you, but we're running on time in a short space. But you've just really laid out where I want to go next, because it is International Men's Health Week, and we're talking about making connections around checking in and checking up and checking it out if there's something you're concerned about as a man. And I'm saying, what is your call to action then? Because I mean, you have stood in the gate, you've done something that I'm sure you thought about a lot, and you said, I better follow up on this, and you did, and it's grown into something. A call to action for men and women and all over this island. What are you saying to us then might be our call to action for engaging men in our health and our well-being? Very briefly.
Well, for me, and to put it in brief, I am going to listen a lot more to people. As they say, 2 ears, 1 mouth. And it's what you learn from listening and to make them connections. I am asking, and people know it themselves, whether it's, as you said, the neighbour across the road or 10 doors down that you didn't know or whatever else. Ask them, how are you? How is things? And how are you keeping? And if there's ever anything, I always say, what can I do to the person? Or personally, what can I do for people around me? And just to be cognizant. And to end on this, someone sent I seen a video this week, men don't cry. Men do cry. Men should cry. And again, men should be themselves. And maybe it's the generation ahead or our generation. But if everyone can make a concerted effort just to be ourselves and to look out and look after each other, that's, you know what, we'll be a better person, we'll be a better people, and we'll be a better community going forward.
David, thank you so much. I said you sparkled on the pitch for all of us. We have those great moments. You're sparkling still. You're sparkling still.
You over-exaggerated the pitch part, but fair play to you.
No, I didn't. I didn't over-exaggerate. And thanks for sparkling here with us and putting that call out to all of us. And we wish you well in your time ahead. And thank you for being with us here today.
Pleasure, Lorcan, and fair play to you all.
Thank you very much. So that was our David. And I mean, just so lovely and so really good, and a call to action to all of us. And we're moving on from there now into the next part of our day. Thank you so much, David Brady. Just remarkable. I had so many questions I would have loved to ask him. But we have a lovely group of people here as well. So Anne is back with us, Anne Farrell is here, and we have John is here with us as well. We're bringing our panel for the next piece of our discussion. And we'll tell you who they are as well. So I've already introduced to you our Anne, and Anne is from Anne Farrell is the Health Promotion Executive with CIE Transport Group from Bus Air and Dublin Irish Rail. And as I said, she's one of our facilitators and she's one of our trainers as well. We have James Egan as well, and James is Executive Safety Training Services. So he's with the Construction Industry Federation, and he's going to share with us his experience of what they've been involved in as well. And we also have Anne Flannery. And Anne is based there in Dublin. She's done incredible work as well up in the Ballybox Centre over the years, and an interest and a background in community education. And she's brought all of that as well back into Ballybox in the work that she's been doing. Folks, you're really welcome. Thank you very much for joining us. Can I go back to Anne just for a moment, Anne Farrell, because Anne, again, you saw the link there between David, what he was saying also, and your own kind of input. to go back to the very start of what you talked about, how important was it? How very important was it, do you think, in relation to building your own capacity, first of all, with an evidence base to be able to begin and engage with men in relation to our health and well-being?
Yeah, Lorcan, it's just to have structure and to have that research piece. It gives you confidence in actually succeeding. And, you know, I've used it in my coaching practice as well, you know, and a lot of men, they talk shoulder to shoulder. And, you know, since COVID, I've been, you know, coaching clients in the park and outside, and that's worked really well because, you know, men don't really like clinical settings. So yeah, we, you know, and it needs to evolve. And we like, from my end of things in workplace wellness, we need to do a lot more research from our end. So I'm talking with my boss around that that piece as well. So I think, you know, in collaboration in going forward, there's still lots to learn, and we're still, you know, evaluating things as we go.
And Anne Flannery, you had already kind of, you know, been so involved with the Ballybox Centre in relation to creating targeted programs based on some of what Anna's talked about. Yes. You know, finding that hook, and Anna talked about finding the hook around engaging men who maybe might not come along to other services. What you're learning in relation?
It's interesting. I mean, Anne has touched on a number of the key points there around certainly involving men in the initial process. And that's exactly what we did. We were unsuccessful in, I guess, reaching out and in engaging men in programs up to that point. And the year is 2009, and it's significant because, as has already been mentioned, the Men's Health Policy document, the first ever, was launched in that year. So we I suppose, brought together a cohort of men from the community, sat around the table in the Larkin Centre. And one of the things they said to us, listen, if you want to engage men, they need to be, you know, involved in something that's of interest to them. And they said, look, it needs to have a sports theme. It needs to have something that's sports based, because that's what men, or most men, are interested in. And I guess that set us on a journey of trying to sort of figure out, well, what we could do that might, you know, be relevant. And happily, we came across a program that was running by being run by Glasgow Celtic, called the Wellman Programme, which used the appeal of sport to kind of get men involved in an initiative that focused on supporting them to build positive lifestyle practices. So, you know, we took their model, which focused at the time on fitness, on health checks and health education talks. We added a couple of more things to it. We added cookery to it, and we adapted it to be relevant to our own kind of local context. So, you know, the Wellman Programme proved to be so, I suppose, significant in so many other ways as well, because it showed, you know, you can do these things in a non-medical setting. It doesn't necessarily be, you know, it wasn't associating health with just a GP clinic. It was something that was normalizing health as part of day-to-day community life. So really, really, really significant for us.
And very successful, as we know from the evaluations as well across the time.
Yeah, you know, like, you know, it's one, as, you know, as being part of the community, we're all really proud of. You know, it started in 2009, and, you know, there was a sense that, you know what, you'll never get men, you know, across the threshold. They won't get involved. But I guess, look, we were blessed because a couple of things came together. Celtic agreed to work with us on the initial set of programs. And basically, once Celtic have a huge fan base in the northeast inner city of Dublin, and once, I suppose, that it was known that Celtic were coming to town, that really generated a buzz.
You had the hook.
We had a hook. They were it. But, you know, from that, other things happened as well. As say, the men's policy document was there, so that, I guess, gave it, you know, official or policy legitimacy as well. Dublin City Council opened up the facility you were talking about there in Ballybock. So without the sort of that, the sort of the infrastructure was there that allowed us run it within a community setting on kind of local turf. Really, really important.
Okay, Anne, thank you very much. John, you're welcome as well, and thank you for joining us, and coming from the CIF as well, the Construction Industry Federation. You know, when we talked earlier, John, you were saying yourselves, you've been doing so much, and thank you for information that you sent me on as well. In relation to the work, I mean, you talked about, I suppose, moving in, like Anne, the two Annes have said to us here, in relation to coming in and seeing and looking at what could be done. But you came in, as you said, from more of a reaction than a response to the initial pieces of work that you were doing in an industry that has a lot of men in it. Not all men, but a lot of men in it.
Yeah, thanks, Lorcan. Absolutely. And admittedly, some of our response was quite reactionary. So maybe 6 or 7 years ago, we partnered with Pieta House. We had a campaign around, it was entitled Mind Our Workers, and it was all about building on conversations. So there is generally great camaraderie in construction, and you know, whether it's at work or in journeys to and from work, but we were trying to open up the conversations. And it was not only about how to spark a conversation if you see someone in distress, but it was also, you know, where to seek assistance as well. So admittedly, yeah, it was reactionary, and what we found was that the prevalence of people in distress or even suicidal thoughts was much more prevalent than we could have imagined.
Anne Farrell had mentioned in our presentation around the importance, John, I'll stay with you for a moment, in relation to, you know, moving the interactions and working with men from just a personal one-to-one to bring it into the infrastructure of your own systems. You've been very much part of that as well, because you move from a reaction into a more planned response in what you've been doing in more recent times.
Yeah, no, certainly, and it's you know, as David was saying, it's about the listening. So so we have every year we facilitate Construction Safety Week, and as part of that, we survey our members. Well, what do you want to focus on? And the first thing that is continuously the first theme that is always agreed on is mental health and well-being. So so I guess we've listened to our members there, and what we try to do is again build on that. So not only do we have that intervention stage with, you know, Pieta House, that we needed to be more proactive. So to that end, I guess we focus on getting some keynote speakers and having toolbox talks on a site. But then we recognize, well, we need to do more again, and that's where we started up an EAP then for construction workers. And then that even has been expanded even more recently, where we I guess we partnered with the Lighthouse Club, which is a construction industry charity. They've been you know, formed here in Dublin, or founded here in Dublin in 1964, but very low key, except for those that actually avail of the services and those that contributed. So we've been, I guess, trying to raise that awareness and certainly getting more information out there. And again, the whole thing is that everyone encounters, you know, stress, duress at some stage in their lives. It's nothing to be ashamed of, and we just need to have the resources there to assist them.
Just at the start, Anne Farrell, when we showed the video about men's fears, and both yourself and John are, you know, you're in industries that have very big numbers of men as well as part of them. You know, is fear, procrastination, the obstacles, the barriers, are they real for men, or is that changing? Is there, you know, there's not one type of men, there are many types of masculinity, expressions of it. Is it shifting? Is it changing? To go back to even what we were talking about in our last interview, that isolationist approach, are we coming out more ready to talk?
Yeah, well, I suppose like I get a lot of referrals from our own medical staff, and they give them my number, and they can be holding that number in their pocket for about 6 months. You know, it's a big deal for a man to pick up the phone and ask for help. Yeah, I suppose in different demographics, the older men are slower to engage, the younger men are more open to conversations. But I suppose it's work like this and these webinars, and, you know, just getting the, you know, and what the work that David Brady has done has been excellent, you know, and that really, I suppose it's real men talking to other real men, and I think, you know, men have the solutions and they have the answers, and we have to give them more credit, but they just do need a platform that's psychologically safe to do that. But we, you know, it's just building a structure, and I think the workplace is a brilliant platform to engage men, and they're comfortable at work. But it's we still need more work to do, to follow on. But I think a lot of the safety departments in our organisations are really looking at that health aspect now. So health is kind of coming on a par with the safety, which is really good.
Yeah. Can I come back to John on that as well? Because John, I'm just wondering, in the movement from health and safety to incorporate health and well-being, is it a big cultural shift? Is the transition fluid, or is it a challenge to bring that new shift into your culture in relation to supporting men and men responding to it?
Yeah, no, it's certainly at the outset, what appeared to ourselves as a major cultural shift. But in reality, the transition has been relatively easy, and there tends to be an appetite. Now, what we found again is that, having someone as an ambassador, or someone that, is passionate about the subject, the likes of David, he's inspirational. And we've kind of leveraged off that approach. And some of our member companies, they've been CEOs, or they've, past or present sports persons, they have been the link to getting message out there. So certainly, but I will say that there is we've seen as well that, in terms of generations, there's a generational approach as well that, certainly younger workers, we found that they're certainly more aware of well-being. It's a fundamental right that they have, and they're, the likes of, I guess, the more that's out there, that likes of this event, and even Operation Transformation, RTE, there's a whole appreciation of it that we need to focus on, not only on the physiological, but the psychological as well.
Anne Flannery, John has just mentioned something, and probably we've seen it in the last interview as well. The importance of champions. You had the brand of Celtic, and I met some of the guys up there, and they were also very personable men, talked about their health and well. Absolutely essential, isn't it, that we can grow champions or connectors? Of
course it is. Of course it is. Yeah, I suppose people who can show that what's learned on the pitch has equal, I suppose, significance for other life lessons as well, and are happy to share and you use and support other men to take care of themselves, to talk about the subject of health and well-being. We've been so fortunate. We've had some really, I suppose, high-profile people from Glasgow Celtic, and in more recent years, Pat Gilroy from Dublin GAA has become our ambassador for the programme, and all have shown a real strong commitment to promoting the programme, to doing what they can to, enable the subject of men's health to be aired as frequently as possible. It is about kind of creating platforms. It's about, I suppose, having enabling environments that create a context for all of these issues to be discussed. So really important.
Okay, John, I'm going to come back to you just for a moment, because just as Anne is speaking there about champions and the importance of, profiling what we're doing, even for International Men's Health Week, it's really great that so many people get on board. There are so many partners involved across the island of Ireland this week promoting the key messages of Men's Health Week, which is fantastic. I'm sure many of them are online here with us today. But, when it's maybe just me, you, and somebody else standing in isolation, I can feel like it's piecemeal. And just especially in relation to the workplace, I know somebody who's always saying it's so important that we move it from just bits and pieces to systemic change. And is that on the way? Are we really getting to the stage, do you feel, that in our industries we're going to have health and well-being, health and safety, and there's going to be that blended learning that we talk about so much now as we go into the future? Is that the future?
Oh, I certainly think so. I know certainly in our industry that people would be more moving towards a well-being policy. So it's not just health and safety. And certainly from a construction side, that would have been the historical approach, but it is now being expanded. And I think there's certainly more of an appreciation that you need to look after the individuals, not only when they're at work, but outside of work as well. So certainly the idea of having an EAP or even the, I can't speak highly enough for the Lighthouse Club in terms of having a mechanism there where you can download an app and you can check in every day, and it's simply, how are you feeling today? Do you need help? And if you click on the I need help, it will give you a range of options to who to go to, and they're all very specialist, organizations that you'll be linked to. So I certainly think that there is. I know we had the CIF organised a survey of our member companies last year. So we had about over 1,200 companies contributed to it, and it was really insightful in terms of, are they doing something in that sphere, and what are the key areas? And I guess one of the kind of key stats that jumped out at us is that 16% of persons that I guess submitted the survey said that they would be fearful about raising any issues around mental health or well-being, which, that's straight away, that's something we need to tackle.
And that's a significant number as well. If it's so it is something that needs to be tackled. I'm conscious with time for us that we will be coming up, and I want to make sure the three of you bring your experience to this question. And I'm just wondering, because from three different backgrounds, but there's a lot of crossover in engaging men. In your experience now, professionally, David Brady talked about his key learning was, after all the chatting and phoning, listening. It's about listening. It's about responding from a listening place. What have your own key learnings have been, Anne Farrell? What's your real key learning? You've done a lot of work out in the field with men and engaging men. And what's really stays with you in relation to your key learnings? Is a fair question for you. Put it all into one space, just briefly.
Well, I believe, men have so much potential. And, when I coach men, I just say, you've infinitive potential to, and I think it's empowering men and telling them that they are of worth and value. And I suppose, traditionally men have been stoic and providing for families, and they leave their own needs to last. And, I think for them to be self-full, or, that people, they can feel guilty if they're taking time out for themselves, or they feel selfish, but I think they have to fill themselves first before they can give to others. And I suppose my wish and dream that for our staff, that they retire in optimal health, and that we as a company will provide the support and structure that they do. And I remember joining Irish Rail first, and all the emails that were flooding into my email box of, RIP death notices, men that had died too soon, they'd really given a loyal service to work, but they didn't even reach retirement. And this saddened me a lot, because a lot of it was lifestyle and preventable. So, I suppose I just want, my wish is that people retire in optimal health, and men do, and enjoy their retirement.
Okay, it's a good vision and action to have. And Anne Farrell as well, or Anne Flannery, I mean, in relation to your own work then, I know your work, I know the men, I've met some of your men, really great guys to go up and do a piece of work with. And again, what is it stays with you, I suppose, in relation to, very briefly, we're running on time.
I know, I suppose I'm mindful of a quote that from one of the men who said, I left school at 12, I got a job, and I never had a chance to learn how to look after myself until this program. Mm-hmm. So we need to create so many opportunities for men to be able to, pay attention to their needs, to look after themselves, to be caring and nurturing of themselves. And that would be my hope.
Okay, and John, moving from reaction to response to an integrated approach within your own systems, making it systemic. What have you learned along the way as well in all of that? It's been a big journey too.
It has, and absolutely. And rather than having a once a year campaign on it, this is something that I guess we've taken an approach. We've pretty much modelled a 12-month calendar on Healthy Ireland's calendar. So it's a health, safety and well-being. So we'd have a theme for the month, and we provide resources around that. And I guess what we tried to do is to get champions for each month, that they would, be a point that an expert in whatever field that they're in, and share the messaging, and whether that's health, safety or well-being, whichever is applicable.
Folks, look, thank you so much for sharing your time, your expertise, your experience, and your hopes and your wishes for the times ahead, and especially being with us on International Men's Health Week. We really appreciate it. And I see our Fergal has come in there now, because he's an important piece of work to do for us as well in relation to the call out. Fergal, can I hand over to you? It's all yours for a few moments. We'll come back in a few moments. Thanks, folks. That was really lovely.
Thank you, Lorcan, and thanks to all the panel. And thanks in particular to David Brady for that lovely presentation. Really appreciate you giving us the time, David. And to the panel there, you know, from a community setting to workplace settings and what can be done in relation to men's health. It's really, I know Anne Flannery said that David Brady was inspiring, but you're all very inspiring in terms of what's been done in recent years. And I was just looking, I suppose, at the questions that had come in on the registration page. And a few people had commented actually that we made the questions a mandatory field in the registration page. Sorry about that, but it's interesting to read the questions that came in. And a lot of people are like, it's a very diverse audience on today. You know, like there's people looking for themselves, for their own health as men. There's people looking for their own advice on men in their lives, you know, their husbands and their partners and whatever. And there's people looking for advice on how to engage with men in workplaces and in all types of settings. So it's a very diverse audience. We nearly had 300 on there at one stage. So I suppose I'm going to just, you know, give you some signposts and some information that we have on our HSE website that will hopefully be helpful. Just picking out some of the themes that I picked up on those questions. I just want to try and respond to them, particularly with the men that kind of registered for this event themselves and are looking for, you know, how would they, looking for advice on maybe losing weight or checking out their mental health and things like that. So I suppose we have a lot of information and resources on the HSE website under HSE Health and Wellbeing. And I would encourage everybody to check that out. And I'll give a bit more detail on that as I finish up. But we have a lot of information. But for those men that are feeling that they want to, you know, initiate an action for their health and well-being, I just encourage them to, you know, take a first step. And walking is often the simplest form of exercise, you know, for people that can get out and get started. And in terms of maintaining the exercise, setting a routine for yourself, and getting maybe a buddy to go with you, whatever that is, I think that you're much more likely to keep it going for a couple of weeks, and then it becomes a normalized piece, you know. Like a lot of the speakers have said before, health and wellbeing has shot up the agenda with COVID. Like, I don't think there's any person that hasn't taken a long, hard look at their own health and wellbeing in the last 18 months. I know from my own point of view, the you know, working from home has been head wrecking, but when I look at my colleagues in the HSE and what they've had to put up with and what they've had to deal with in terms of COVID, it's been incredible, the stress and strain on so many parts of the health service and my colleagues. And then in recent weeks, having to put up with the limitations due to the cyber attack, it's been extremely difficult. So I wish them all the best, and I appreciate all the HSE staff that are on here today. And obviously many of them have had to use their own personal devices and Gmail addresses to log on today to today's webinar, but I appreciate their support. Some of the other things that I think, you know, I have learned during COVID in relation to men's health, like the Sheds for Life impact report, we'll share a link with that, which in our follow-up email, but the Irish Men's Sheds Association launched their impact report on Monday. And, you know, the evaluation or that impact report is very powerful, and I encourage you all to take the time to read it. But it really, like what we were saying on the launch on Monday, we've known for some time that sheds were kind of a health enhancing setting, but we've put a flexible, formalized health program into that setting through the Sheds for Life program. And there's so many men getting a positive output out of that, and we hope to increase and scale up that initiative. So that's been very positive. And personally, then I've seen the impact of sheds here locally. I came across one of our shed leaders, a TP O'Gorman, a couple of times during COVID in the community, and he'd always stop chatting to you, and I'd ask him how the men are doing, because I knew, well, he was connecting with them all the time by phone anyway. But I met him outside a shop having a cup of tea with a couple of other shed members at a bench, and he said they were going out. They were just back from going out to somebody's house, a shed member of theirs that has dementia, and they went out to his garden basically, and they played some music and they engaged him, and they, you know, they got the approval from the shedder's partner that was out there. But I just thought it was a lovely example, and this was in, you know, this was in some of the challenging times of COVID, but the connections that they were trying to maintain and sustain by going out to one of their members, and they knew, well, you know, the partner needed a bit of respite in terms of her husband's dementia, and that he would easily engage with the music that he would have heard in the shed and things like that. I just thought that was a beautiful example of of making the connections, really, and that's the theme for Men's Health Week that we keep coming back to today. You know, and I would encourage everybody on here today to do something positive for their Men's Health Week. And Saturday is our pledge day. So I'd really encourage people to make some sort of a pledge to themselves around men's health. It might be your health or the health of other men and boys. And I'd encourage you to share that on social media using the hashtag Men's Health Week. So, you know, we're just trying to raise awareness of men's health, but I think those simple pledges will show example for everyone out there. And as I said, I want to just highlight some of the resources that are out there. You know, in the last year, we've put a lot more effort in HSE Health and Wellbeing developing online resources. And we have them, like there's an online program still been broadcast, the stress control program, that has given huge benefits to people in supporting their thinking and getting away from negative thoughts and developing positive thinking in relation to their stress management and stress control. We have a positive mental health program called Mind in Your Wellbeing that's on the HSE Health and Wellbeing YouTube channel, which I'd encourage you to check out. And that's a positive mental health program, and that kind of really breaks down the elements of positive mental health. Like, you hear a lot of talk about resilience and things like that, and positive psychology. That really breaks it down into, we have 5 20-minute videos that really kind of break it down and make it consumable. And you can put it'll give you a frame of reference for what you may need to do to support your own mental well-being. We've also some practical exercise videos. We launched our Pilates for beginners videos and yoga for beginners videos, and we're kind of well aware that these are more likely to be a hit with the female audience, but I'd really encourage men out there to try them. And because they're aimed at beginners, you know, there's no obstacle to it. It's very low equipment, and you just watch and follow the exercises. And we have a strength and condition and exercise videos, a set of those videos coming up in the next 2 weeks as well. So there's something there for everybody, is what I'm saying. The other things that, we have information on for help and supports for people looking to quit smoking. And we have a website on dementia, the Understand Together campaign. I know that does impact on a lot of our families. And we have the askaboutAlcohol.ie resource. There's huge resources there. So I suppose what I'm saying is, you know, there's a lot of information, and sometimes it's just trying to get it out to the public. And I know that a lot of people on here are champions, or they're trying to bring this information to a larger audience. So we'll try and send you, without sending you too much information in the follow-up email, give you some important links to the key web pages and information resources that are out there. So finally, really, I just want to come back to the pledge day and just remind you all again that that's on Saturday, and I'd really appreciate any support, any small action at all, even if it is, I suppose, one of the things that I've seen that I need to do is my pledge is going to be, you know, spending a bit of one-on-one time with my sons. I have 3 sons, and they're all just, you know, one is 14, 10, and 6, and, you know, they drive you up the wall sometimes. But I've noticed, and our little 6-year-old is kind of, he's the only constant in a good mood guy during COVID. You know, his mood never dipped. He never knocked the light out of him to be at home. So that's positive. But he was keen to have a bro day with his dad and spend a bit of one-on-one time. So that's really one of the things that I'm trying to commit to, spend a bit of one-on-one time with my sons as we kind of emerge now from lockdown with a bit more flexibility. But all we're asking you to do is commit to any action in terms of men's health and share it on social media using the hashtag Men's Health Week. And finally, I'd like to wish you all the best of health and wellbeing for the rest of Men's Health Week and the rest of the year. And thank you all for your attendance today. Thank you very much.
Thank you, Fergal, for that. A lovely finish to our afternoon. And as I say, again, to go out and check out mhfi.org, all those resources are there, along with the other resources that Fergal has been talking about as well. And if you do get a chance, check us out as well at mensnetwork.ie, especially if you're Wexford, Waterford or Kilkenny, because we have a Walking the Talk program you might like to find out about. Go in there and you'll find us, mensnetwork.ie. Look, thank you so much to everybody for being part of this day. Thank you to Helena and her team as well in IMS, who have minded us so well technically across the last hour and 20 minutes. We really appreciate it. So look, at everybody, go well and mind yourselves, and keep an eye out for information about our next webinar, which will be in the future as well. We'll be back to talk to you with webinar number 3 for engaging with men. So go well all and mind yourselves.